Bismillahirrahmanirrahim. So, dear student, today we are going to talk about cardiac cycle. What is cardiac cycle? Actually, cardiac cycle is uh, the event that occur between two cardiac two heartbeats. Okay, let's one heartbeat take place, and next heartbeat are going to occur, and now the events that occur between the two heartbeats are called cardiac cycle. Let we talk about a cardiac cycle from with the help of a diagram. We will talk about that which part of the earth is a specific time of their duration. This is heart, simple structure. This is left atrium, this is right atrium, this is left ventricle, this is right ventricle. Okay, now let's consider first of all what happen when blood come here into the right atrium from superior vena cava and inferior vena cava. This is superior vena cava, and this is inferior vena cava. Blood come inside the right atrium. Now the atrium will contract, and it will uh, pump the blood into the right ventricle through AV valve, which is tricapsid valve. Next, what will happen? The blood will be pumped into lung. Okay, blood will be pumped into lungs, left lung, and here we have right lung through pulmonary artery. Okay, this is left pulmonary artery. Here we are going very simple structure. We are drawing to we are drawing very simple structure. This is pulmonary artery. This is pulmonary artery. Here the blood is pumped. Next, what will happen? That the blood from the lung, which will be oxygenated, oxygen combine with the blood hemoglobin in lungs. So the blood will come into the left atrium, and then the left atrium will contract and pump the blood into the left ventricle. Finally, what will happen? Actually, finally the left ventricle will have strong contraction and will pump the blood into the aorta. This is aorta. We are going very simple structure here. We are going to draw very simple structure. This is blood which is pumped into the aorta. This is aorta. Okay, now what is systole and what is diastole? So here, what is systole? Systole is contraction of heart muscle. Contraction of heart muscle. Simply we write here heart. Contraction of heart is called systole. Okay, and what is diastole? Diastole is a relaxation of heart. Actually, heart muscle. Okay, so when any part of the heart that atrium or ventricle contract, we call it is a systole. Let's This is an atria which contract, so its contraction will take 0.1 second. Mean atria contraction takes 0.1 second. Next, what will happen? Ventricle will contract and which will take 0.3 second. It is for both ventricle. Okay, both ventricle take 0.3 second to contract. So here we can conclude that duration of complete systole, total systole, mean atrial plus ventricular systole is 0.4 second, 0.1 for atria and 0.3 for ventricle. So the total time taken by the systole is 0.4 second. Now what is diastole? Diastole is actually the relaxation of the heart. It is a part that during systole, for example here, during systole blood is always pumped out of the heart either into the lung or into the systemic heart circulation. Let right ventricle contract, the blood will be pumped into the lungs out of the heart. Let left ventricle contract, then the blood will pump to all the tissue in through the arteries. Okay, so during systole, blood is pumped out of the heart to other part of the body, that lung and tissues. Where in tissue the blood is required. because there is a need of oxygen. But it is important to know that diastole, which is actually a relaxation of heart. Okay, so atrial diastole takes 0.4 second. It is important to know that both atrial and ventricular diastole take 0.4 second. It means that atria and ventricle relaxes and it take 0.4 seconds for their relaxation. This is about diastole. Actually, what will happen in diastole? In diastole, the blood muscle loses. Okay, and actually, blood come inside the heart and the filling of the ventricle occur. Okay, this is called simple. This is the simple explanation of the diastole. So here we are going to talk about what is the cardiac cycle per 1 minute. It is important to know that there are 72 heartbeats, heartbeats, okay, heartbeats पर मिनट ओके और वन heartbeat जो है एक heartbeat जो है एक heartbeat take about 0.8 second okay 72 heartbeats occur in 1 minute and one heartbeat takes 0.8 second. This is what we have discussed about cardiac cycle. So now we are going to talk about art sounds. Okay, what are the art sounds? Okay, so here we are going to draw a simple structure of the art which represent these structures that we have discussed here. Let this is same we have discussed already. Okay, this is right atrium, this is left atrium, this is right ventricle, this is left ventricle. Okay, here we are going to talk about some walls. There is a wall we have drawn actually are very far from one another, but actually they are not so far. Let's consider this is the wall. This is the wall. It is called tricapsid wall. What? Tricapsid wall. This is AV wall. AV mean between atrium and ventricular. AV wall. Here there is a wall which is called mitral or mitral valve, which is between left atrium and left ventricle. Okay, so these are two walls. Next here is aorta, and there is a wall in the aorta opening. So when mitral wall, what are actually are sound? These are certain sounds that are produced during the movement of the blood through the heart, during pumping of the heart. Okay, so at different moments different sound are produced in the heart. Let's consider a mitral wall. When mitral wall closes, this is called mitral wall. It closes, it produces a sound which is called first or sound. Okay, सो क्लोजर ऑफ मीटर वाल प्रोड्यूस फर्स्ट और साउंड. ठीक है, जब मीटर वाल जो है ये जब क्लोज हो जाएगा तो इसके वजह इसकी व्हेन दिस मीटर वाल विल क्लोज इट विल प्रोड्यूस अ साउंड विच इज कॉल्ड फर्स्ट और साउंड. सेकंड थिंग, दिस इज aorta wall. This is wall of aorta. When it open, it will produce no sound, and but when it will close, it will produce a sound called second sound. Opening of aortic wall produce no sound, but closure of aortic and similarly pulmonary wall produce second or sound. What is there? Here is a pulmonary wall we already have discussed, which are blood is entered from right ventricle. Okay, so this is pulmonary wall. Actually, it is here, and this is aorta wall. Their closer produce a sound which is called second heart sound. Okay, this is a we have second heart sound. Now let's consider there is another sound which is called S3, and repeat passive ventricular filling produce sound which is called S3 sound. Okay, this S3 sound. What is mean by rapid passive ventricular filling? देखिए, look here. this is atrium, left atrium, and this is ventricular. When blood come into the atrium from lungs, the atrium wall opens and the blood move into the ventricle directly. The blood that enter into the atrium directly move into the ventricle. Here it is called passive ventricular filling because uh, the blood is directly coming into the ventricle. Okay, and the wall is very loose here for the blood. So this will produce sound which is called S3 sound. So it is important to know that these are the different sounds that are produced. You can take a screenshot. And what are these sound? These sound are due to pumping of the blood in different part of the heart. So we here talk about heart sound. It is important to know that in cardiac cycle, if the increase heart rate, then the duration of cardiac cycle will decreases. Let's for example, if heartbeat increases in small time, a large number of heartbeats will occur. So one heartbeat will take a less time than as compared to the normal. So this is all about cardiac cycle, and in last video it is hope that we draw the ACG form of a cardiac cycle. So if you liked this video, please subscribe my channel and also like my channels. uh, a lot of thanks. Assalamu alaikum.